BrightStar Care is doing a lot to stay out in front of industry changes. We always have. We're very data focused. We've been investing in Medicare Advantage since 2018, spending 6 figures per year, having consultants help educate us as to how consumers are going to want to engage with their Medicare Advantage benefit, doing projections of where the opportunities would reside, and then leveraging our own data because we're the only brand that has all of our data since our inception in the same data warehouse, doing longitudinal studies with healthcare organizations that are mapping that against Medicare claims data to know that we actually do bend the cost curve, an average of $13,000 per member and up to $30,000 per member, depending on the diagnoses. And we've been the only home care brand that has been successful in demonstrating our success and our outcomes, but also having the data and being able to publish that study. It's going to be really important. We also have leaned into consumer surveys. Why do consumers care about their Medicare Advantage benefit? How will their Medicare Advantage benefit influence who they want to use as their agency in the home? And will they move away from the agency they have if that agency doesn't accept their Medicare Advantage benefit? More on that later. We also wanted to make sure we were an early adopter in Medicare Advantage because plan networks will close. And we want to make sure that we can develop those relationships. We can be their go-to agency on a national scale. And we recognize that because things are evolving in a period of uncertainty from an economic perspective, that having government payer as a significant and growing source of how care hours will be paid for will make our economic model for our franchisees much more viable and sustainable in the long term. Not saying change is easy. It does mean that we probably are moving some of our proportion of business away from higher margin, private pay business to more stable and certain larger volume business and Medicare Advantage. But we don't want to relive what happened to Blockbuster. Blockbuster didn't want to evolve because their franchisees didn't want to give up late fees. It was the biggest source of their profitability and revenue. But we all know how that turned out. And we're being proactive, innovative, and willing to disrupt the industry and go through change to make sure that we're moving towards Medicare Advantage, and we're putting our money where our mouth is. We are now effectively the largest franchisee in our network. We have significantly grown our company-owned footprint, moving from approximately 2 locations 18 months ago to 20 locations now and growing, so that we can take more Medicare Advantage, we can lean into more demonstration projects, and as we start to see opportunities to be paid for performance versus being paid a flat amount per hour, that we can learn and have great things to be able to share with our franchisees to help them follow what we've done and do it successfully.